from Lori Walsh again on the Visitation Saves Lives project. Then we'll discuss some upcoming topics, see what your questions for Department of Health and Department of Human Services as they're our next speakers. I'm sure everybody can see that if you didn't get the memo, Senator Ward was actually called back into legislative session this week. So she is postponing her call with us. She did answer our questions though, so we'll be able to get those answers out to you guys soon. Now I'm going to turn it over to Kim for our virtual meeting tips.
Good evening, everybody. I hope you're doing well. Here are our virtual meeting tips. You're going to need to, you've all been muted upon entry, and I try to keep those lines muted throughout the meeting just so that we can keep the background noise down. We'll open your lines in a little while though when we get to the Q&A session. So what you'll want to do if you want to speak is use the raise your hand feature, which is located next to your video. So if you're able to see the screen that you see, there's like at the bottom or top, either depending on how your screen's configured, you'll have an icon to mute yourself and also to start and stop your video, as well as a little bubble to pull down that looks like a thought bubble for the chat. So we will call on you when you click on the raise hand feature, or you can also use your chat feature to chat with us. And Jeannie just demonstrated raising her hand for us, so she's found where to use that. If you hover your mouse near the bottom of your screen, and for some of you it may be the top depending on the size of your screen, you'll see the participants tab. You can click on that and that can be expanded, so you're able to see all the participants that are in the meeting, and you can chat with them individually or with the entire group. The chat feature, like I said, is also at the bottom or top of your screen, depending on how it's configured. When you click on that thought bubble, you're allowed to select everyone or just an individual person to speak to. We will be using polling questions toward the end of our meeting tonight, and those polling questions will just pop up on your screen once we enable them. You'll simply click on your answers and hit submit, and we'll be able to view those answers in real time. You'll remain anonymous, but we'll get to see a percentage of the answers for each question. If you need to step away from your computer anytime during the meeting tonight or your phone, if you just click on the video icon that looks like a movie camera, you're able to stop your video, and that way we won't be able to see what you're doing. So that's always helpful. I know I've seen some funny stuff over the last few weeks. So make sure you click that so you can close your camera out if you don't want us to see what you're doing. As Jamie said in her confidentiality tips, we don't want you to identify your loved ones by name or facility. However, if you have specific concerns or complaints, they can be directed to the State Ombudsman Office in 2 different ways. You can direct them to us by calling the number you see on the screen, which is 717-783-8975. And Jay Rotz, our administrative assistant, will be happy to forward your call on to one of our local ombudsman entities who can help get the word out to them that you need assistance. And you can also use email, which we got a little cutoff here, but I'll give you that email address. It's ltc-ombudsman@pa.gov. And Jay also always is so kind to put that in our chat feature, so you can access those from the chat as well. So those are our virtual meeting tips, and we're going to move on now to our speakers for the day.
Right. Now we're going to hear from Cori Hurley. She is the Dauphin County Ombudsman, and she's going to give us voting rights.
Good afternoon. This has been an issue that, especially after the primary election, we all realized, oh, maybe the process hasn't gone so well and residents aren't quite aware of the rights, or they weren't actually respected. So we thought we'd review resident rights in regards to voting and how that process should go. So we want to make sure that you are aware of things and helping your loved ones prepare for the election in the fall. So we'll give you some resources, and hopefully that'll help you through and help you help your family members. Especially since I know a lot of nursing homes and personal care homes have been designated polling places in the past, and that could not happen this spring. So most likely that will not be the case in the fall either. So you want to make sure you're prepared with all those resources. So next slide, please. So a citizen's right cannot be discriminated upon based on race, ethnicity, national origin, or being a member of what they call a language minority, which in this country is essentially meaning you're not an English speaker as your primary language. So Pennsylvania provides voter registration forms in English, Spanish, simplified Chinese, traditional Chinese, and Vietnamese. If your county happens to have 5% of the population speaking another language of any minority language, the county must provide voting information and services in that population's language. Currently in Pennsylvania, only Berks, Lehigh, and Philadelphia counties are the only ones required to provide this information in another language, and that is Spanish. Obviously, voters should not be intimidated or coerced on their voting decisions. Seniors with a disability can vote independently and privately. We'll elaborate on those a little bit further here. Next slide, please. Okay, so in order to vote, obviously the primary issue is being registered first. For the general election, November 3rd, you must be registered to vote by October 19th, 2020. So I'd say if you're not already registered or your family member isn't, make sure that is the case. To check if a family member or yourself are registered to vote and where your polling place would be, you can check on pavoterservices.pa.gov. You'll enter your county, your zip code, your first and last names, and your date of birth. So it's pretty easy. You probably know that information for your family member. If that voter registration is verified, you get sent to a page where it gives you your active status, your party affiliation, your congressional and Senate districts, as well as your polling place address. I actually spoke with my election office today to determine if that would include mail-in and absentee ballots instead of the polling place, and they're not sure right now. There's a lot of changes that are in the works for the system there. So hopefully this fall they will be. You must be a citizen of the United States at least 30 days prior to the election. And you must be a resident of the district you're going to vote in for at least 30 days prior to the election as well. If you happen to have a family member who's temporarily at a different location than their permanent address, they are advised to vote in their permanent residence. So keep that in mind. Make sure that if your family member just moved to a different address, they are completing a voter registration card for their address change. This is different than what you'd fill out at the Postal Service or through any other address change process, because that doesn't always necessarily get transferred over to your elections office. Your long-term care homes are required to respect residents' voting rights. But unfortunately, that's pretty much what the regulations say, respect voting rights. So the regulations offer very little guidance on meeting this obligation to respect voter rights. Most homes do recognize their role though. They facilitate voter registration, access ballots, and submit ballots for their residents. If your loved one wants your assistance rather than the home's assistance to do this, make sure that you communicate with their, most likely their activities director, to not double dip in this process or duplicate your efforts. Next slide, please. Okay, absentee and mail-in ballots are, I think, going to be most important for our long-term care residents. When you're in a long-term care home, A voter is eligible for an absentee ballot due to illness or physical disability, because they're unable to go to the polls or use voting machines, or just need assistance with the process. Mail-in ballots essentially follow the same rules as absentee ballots. It's just that anyone can do them. I signed up myself for a mail-in ballot, just not knowing what the fall will bring to us. So the same guidelines essentially will apply. You can request for absentee and mail-in ballots an annual absentee or mail-in ballot. So once you receive the ballot, you can request and elect to receive that every year. The reapplication will be mailed to you automatically, and you just make sure that you reapply each year. Keep in mind, there are timelines for this. So once you're registered to vote, you must apply for the absentee ballot or mail-in ballot at least 7 days prior to the election. So this year, for the general election, that's going to be October 27th. I strongly encourage you to apply earlier than that. There's been so many issues with mail and getting what you need. You want to make sure you apply. If that's going to be the process you use, make sure you apply sooner than later, because I don't trust that 7-day turnaround. They're going to mail you an application. You're going to mail back the application. They'll mail you a ballot, and you mail back your ballot. A 7-day turnaround is very tight. So make sure you do that. The ballot must be returned and received by the elections office by 8 p.m. on election night. So do that as soon as you feel comfortable with your votes. Several counties were granted extensions in the primary elections, but we can't necessarily guarantee that. So you want to make sure you get in on time. Otherwise, there's very little option for you there. The county election office will send out ballots after they confirm candidates and proposals on the ballot. This is usually about mid-October, so you have a couple of weeks before the election to have your due diligence and do any research that you might need to. The only other option really is a provisional vote at your polling place, which is not an option at this point for a lot of our consumers. You can track the status of your mail-in or absentee ballot online. It'll tell you when your application has been received, processed, when your ballot's been mailed, when your ballot's been received. So you can confirm closure of the process. And that address is on the screen there, pavoterservices.pa.gov. Unfortunately, it's not currently active because there's no ballots pending. So don't worry about that too much if you get a blank page like I did today. Emergency absentee ballot applications are available if you didn't expect to need one within the last 7 days, but that's quite a process, and they need to be delivered back to the offices by election day, 8 p.m. Voter identification has been a controversy ongoing for the past few years. Although you have to write on your application, whether it be your social security number, your PennDOT photo ID, your driver's license number. There are a couple of sources they use to verify your identity, but ultimately absentee ballot voters are exempt from the voter ID process. So if you can't get a hold of that, or you're assisting with that process, don't worry too much about that, but that makes it just as important to submit these things early. I spoke directly with our local county election offices, and they indicated that they work directly with the activities directors, and they knew each one of their names. So I was really impressed. They are working with our activities departments in nursing homes and personal care homes. So you can feel a little bit of security there that they are working on these things. And actually, I was surprised. They really hold them to the expectations of turning in those ballots in a timely manner, and can even take them to the courts if they don't do so. So there is a level of accountability there that they do submit those absentee ballots on behalf of residents. Next page, please. Okay, so not everyone can vote completely independently, especially if there's absentee ballots. That can be confusing, at least if it's your first time. So the voter application form will ask you what kind of issues do you have that you might need help with voting, whether it be vision or hearing impairments, limited English speaking proficiency, difficulty reading, or any other physical disability. The Voting Accessibility for Elderly and Handicapped Act requires access to polling places or an alternative, which in this case would be absentee ballots potentially, as well as voting aids, large font instructions, telecommunication devices for the deaf, and full ADA compliance, including ramps and such at your polling place. It also allows your polling place officials to move anyone who's 70 years or older to the front of the line. So, that's worth taking advantage of. Just speak with your officials at your polling place. Residents also have the right to choose their own person that they would feel comfortable with assisting with this process, because it is a very personal process. So privacy is a concern. A resident cannot, if they can't physically mark their candidates on the ballot, they have to choose someone else to do so for them. And it should be someone they trust, that they don't mind someone who knows these choices. I spoke with one of my residents who has quadriplegia, and I asked how he does this process, because it can be difficult and exposing. You don't necessarily want people to know who you vote for. He didn't have a problem with it, so it didn't bother him so much because he wasn't shy, but a lot of us prefer more privacy in our voting choices. So the same confidentiality standards that apply to medical issues and care plans should also apply to voting choices. So keep that in mind. That is just another reason why you choose a trusted person as well. If going to the polls, a consumer or a voter can sign a declaration of need for assistance to vote. That probably won't apply to too many of our consumers here, but that is available so that they can show, yes, I do need assistance, and gain that from the polling place. Next slide, please. Okay, I believe this came up quite a bit in our previous meetings, or at least maybe in the chats. So there's always questions as to who can vote. Residents with impairments still have the right to vote. A voter just must be able to communicate their voting choices without any influence by their voting assistant. If a voter cannot communicate their wishes, the assistant cannot mark the ballot. There was a court case that helped to clarify this a little bit. So a federal district court decided that voters are only incompetent to vote if they, quote, lack the capacity to understand the nature and effect of voting, but they cannot make an individual choice, end quote. So the challenge in this is having an actual practical assessment of one's functional ability to vote. At this point, there is no such assessment to guide families or staff at the homes to determine who is appropriate to vote. So when these qualifications are in question, a resident should be considered eligible to vote. And ultimately, without that clear assessment available at this point, if a resident states their wish to vote, they should be assisted to do so. They should not be denied the opportunity to vote. So the capacity obviously changes as a resident goes into later stages of cognitive decline, but studies have found that earlier stages of Alzheimer's, residents are able to grasp the concept and choose for themselves. The later stages, not so much, unfortunately. So that is really decided on a case-by-case basis, and that should be a discussion with each resident. So as long as the resident understands the, quote, nature and effect of voting, their reasons for voting, and their choices should not be questioned. It's not relevant what the rest of us think about why somebody chose to vote in a certain way, as usual. So our county elections offices do not remove voters from the registration list unless, under rare circumstances, they get a court order. This would happen if there is a guardianship assignment, and under extreme circumstances, even under guardianship, that can be decided that they are no longer able to vote. That in no way means that someone under guardianship is not able to vote. In Pennsylvania, that is allowed, except for under those extreme circumstances where there's a special court order that says that they cannot. Otherwise, voters are not removed from the registration list unless they have been confirmed as passing away. The Department of Health sends monthly or bi-monthly reports to each voter office, or elections office, to alert them of who on their voter registration list has passed away. So those lists are not updated otherwise. The home should not be determining who is an eligible voter according to that registration. Next page, please. Okay, so this has been a major issue. I think it was back in 2016 for Resident Rights Month, we focused on voting. And one of the biggest challenges that we faced was access to accurate and unbiased information about our candidates and about the issues. So it's especially difficult when newspapers are going out of business and we don't have access to those distributions. They're unaffordable for a lot of our residents, and they're not being shared amongst residents right now, especially because of COVID times. So we have to find other ways to make sure residents are getting information about their candidates. TV news can be a real challenge. Obviously, it can be very polarizing. So that's a good option for some, not others so much. And obviously, our seniors have limited access to online news sources as well. So this is where, as family members, you might be able to step in and offer your residents some information. So on the screen there's a few websites that offer unbiased, nonpartisan options for learning about your candidates. Vote411.org gives you information in Spanish and English. You just type in your actual address and it brings up all the candidates that are assigned to your area and tells you about their job duties for that position, their individual platforms and backgrounds and contact information, so social media, and you can even find debate videos. So that could be a really great resource. Obviously, you can't necessarily print out a debate video and send it to your family member, but if they have online access, maybe you can forward that on. But you can print information and mail or email it to loved ones so that they can make more informed decisions. So this will be better updated. This site is not full at this point because we're just early on in the process. Also, ballotready.org/PA, you can find information specific to your candidates, their experience, education, their stances on key issues, and it really lays it out so that you can determine who's the best candidate for your situation. USA.gov/voter-research provides a very similar resource, but also tells you a lot about the background of the government processes. So hopefully that'll be helpful to you yourself, as well as relaying that information to your family members. Next page, please. Okay, and finally, complaints. I think probably everybody had experienced some negative aspects of the primary election, in either lack of access to ballots or the process just didn't go very smoothly for us. So the Department of State is responsible for our elections process. They accept complaints from registered voters. So the name and the address on the complaint must match the voter registration for that complaint to be filed appropriately. Complaints can be filed online at votespa.com. And you can also use their voter hotline, 1-877-VOTES-PA. Potential election law violations are investigated possibly by your county board of elections, your county DA, and even the Pennsylvania Attorney General. So when I spoke with our county elections officer, they really seem to take their job very seriously and should have high expectations for your long-term care staff in making sure that they are following procedures and respecting residents' rights to vote. And if they are not doing so, obviously that should be reported. They even, like I said, take them to court at times if need be. So if the home failed to assist with or hindered this process for a resident to take advantage of their right to vote, a complaint can be filed also with the licensing agency. As you probably know, that's the Department of Health for nursing homes and the Department of Human Services for personal care homes and assisted living residents. You can also obviously contact your local ombudsman. We can help you through and investigate that complaint and remedy those concerns. Make sure it doesn't happen in the again, but keep in mind that we don't have that enforcement and punitive authority that those other agencies above do have. So hopefully we'll not experience the same difficulties we did in the primaries, but we're looking forward to the general election, and hopefully you can get your applications and absentee ballots in as soon as possible. That's all I have. Any questions?
Do we have any hands up?
We have one in the chat. This is from Chris. When should a permanent skilled nursing home resident receive their individual ballot? I know the home gets everyone's. I just want to be sure they give it to my mom.
Right. They are usually sent out in mid-October. Each home, I'm sure, addresses this a little bit differently, but if they want their ballot in mid-October when it arrives, then they can vote that, that minute. They usually bundle them together and ship them all in at the same time early. That's great.
Looks like that's it for the chat. I don't know about hands, but Cori, nice job.
Thank you.
Yes, I do have a hand raised in the, and it happens to be me. So, like Carolyn just said, Cori, you did a wonderful job and so concise on summarizing this topic. It took me back. It's hard to believe that it was 4 years already when we had Residents' Rights Month theme about voting, and we got all geared up for that. But it makes me think back to some of my peer groups, the Pennsylvania Empowered Expert Residents groups that we have in some facilities. And that particular year, with the groups that I had at that time, I would ask them, of course we were meeting in person, ask them issues that they wanted to know what the candidate stood for. Say, like, for example, this group was interested in environmental issues, where another one was interested in something totally different. So what I did was sort of gather information, like you said, off the internet and print it off for them. And we made posters with the candidates, and we had people, we had like some mock voting, to gear up for the real voting. So this was like a culmination of things for several months that we worked on right before voting. And plus that got the people in the facilities knowing the residents are really interested in these topics, and they're interested in voting. So that could be, now we're not in the facilities, but that could be something that the family members could help their loved ones with. and finding out what issues they're interested in as far as the elections and researching it for them, either printing off the information or when you have discussions with your family member over the phone or Zoom or whatever, that would give you something to talk about other than the pandemic, which I think is, you know, draining everybody down. But I was really impressed at how interested the residents were at that time about the elections.
Thanks, Carol. I stole that idea. I already wrote it down to make those candidate posters. That's a great idea.
All right. We have any more hands or any questions in the chat? Don't believe so.
No, Jamie, we don't. I'm sorry, I muted my mic.
That's okay. Thank you so much, Cori. You did a fabulous job.
Mhm.
Now we're going to look for Miss Lori.
There she
Hello,
is.
hello.
There she
Hi.
is.
It's the Cori and Lori show today.
Hey.
Where's Dory?
Oh, darn it.
God. Hi, everybody. How are you today? So last week, I came on and talked a little bit about the Visitation Saves Lives effort that's been happening on Facebook. And so just briefly, for those of you that aren't familiar, it was an effort that a number of agencies across the country all did on June 30th. They did a social media campaign. So the hashtag is hashtag Visitation Saves Lives. And it was they're trying to bring it, you know, federal attention to this ongoing problem with nursing home facilities that are still locked down. So last week I came on and talked to you a little bit about it, and I asked folks to share their stories. And I just want to thank everybody who sent me emails with their stories. It really was super helpful. I've created a pretty decent story bank that Cori, the agency that I work for, is going to be using in our advocacy efforts. So I wanted to thank you all for taking the time to tell me your story. I know that it's not easy, and I appreciate you taking the time and making sure that you share it. Last week when we talked, I had talked about you know, the agencies, like I said, across the country who are participating, and I thought that today I would just share with you those groups because I think that it's really important for family members to know that you're not alone. And that there are a lot of advocates out there that are trying really hard to get legislation passed to try and release some of these guidelines and to try and create better situations so that family members can get in to visit their loved ones. So I just want to run through real quick the folks that I came across. I did a search utilizing the Visitation Saves Lives hashtag, and the list. So the first one is Cori, which is where I'm from. And that acronym is the Center for Advocacy for the Rights and Interests of the Elderly. And we are a private nonprofit agency that's dedicated to providing advocacy services for older adults. And we do we have an ombudsman program, and we also do, we have a number of other programs too, but we also do a lot of public policy. So certainly check us out, especially since I work there, right? Next one is Friends of Residents in Long-Term Care. So this group is housed in North Carolina, and they are, and you'll see there are themes here with all these groups because the agencies, they're all private nonprofits. They've been around for a very long time, and all of their missions and their statements about what they do are close to the same. We all are of the same ilk. So they're a private nonprofit, and they're working on behalf of individuals residing in nursing homes, adult care homes, continuing care retirement communities, and private homes who need daily assistance with their social, psychological, medical, or financial needs. The next one is the California Advocates for Nursing Home Reform. They are in California. I would suggest definitely going on to their website, which is www.canhr.org. So California Advocates for Nursing Home Reform .org. So they are very, very active in pushing for sensible visitation for nursing home residents. So definitely check them out. They too are a private nonprofit. They've been dedicated, they're dedicated to improving the choices, care, and quality of life for California's long-term care consumers. And it looks like they do a lot of kind of what Cori does, direct advocacy, community education, legislation, and they to help educate and support. And it looks like they do some litigation as well. So they've got a legal component. Cori does not. The next one is ABLE, which I had never heard of before. I mean, that doesn't mean anything, but I came across them and I was curious. So ABLE stands for the Advocates for Basic Legal Equality. They're located in Ohio. So they are nonprofit regional law firms, and they provide high quality legal assistance in civil matters to help eligible low income individuals and groups. So they, even though they're slightly different from other advocacy groups because they are a law firm, they also house, it looks like they house one of the ombudsman programs. So that's why they have their fingers in the Visitation Saves Lives. The next one is called CanCare Advocates Network. And it looks like they are a Facebook group, and they're out of Kansas. And it looks like it's like a loose group. They're a coalition of advocates for the rights of people served by CanCare. And I'm assuming that CanCare is maybe the insurance that's it's like the medical assistance in Kansas. That's what my opinion is. I could be wrong. I didn't look that up. And it looks like CanCare is actually attached to, I don't know if they're, I don't see them on this list here. It's Kansans for Improvement of Nursing Homes, and their abbreviation is KINH. So that's an actual nonprofit in Kansas. And it looks like that was launched in 1975. And they're looking at citizens concerned about the poor state of care in nursing homes. Next one is Long-Term Care Community Coalition out of New York. So this is another website that you may want to bookmark. They're pretty radical, and they're very vocal about resident rights. And their website, I know that you'll be getting this, but I'm still going to just rattle it off, is nursingHome411.org. So they're a nonprofit organization dedicated to improving quality of care, quality of life, and dignity for elderly and disabled people in nursing homes, assisted living, and other residential settings. So they're in New York. Let's see. I also, there's a number of people here who are familiar with and are on this Caregivers for Compromise Facebook page. And I don't know if anybody here would like to talk a little bit about it. It is a group that was created by the necessity to join forces as a common voice for our loved ones in assisted living facilities who are dying from isolation. I have been part of that group for all of 24 hours. But in that time period that I've been on the group, it's doubled in size. So it's up to about 4,000 people now. And it looks like it originally started as a place for caregivers in Florida to go, but it's outgrown that state. And the main one, Caregivers for Compromise, and it says because isolation kills too. It seems to be turning into sort of like a national group. I would highly recommend anybody who isn't on that page to get on it, because the caregivers are organizing in fashion. They're creating subgroups by state, and they're definitely very focused on being a very strong voice for caregivers. There, and just to let you know that a lot of the folks on that group, the majority of them are family members, but there's also a smattering of providers who are on the group. There are a smattering of long-term care staff who are there. And I've been, I know anybody who knows me would not be shocked to know that I've been very vocal on the group. But I haven't come across other advocates yet. I'm hoping that if there are other advocates like me, they'll be speaking up soon. All right, so the next slide is, these are national agencies that I think that it's really important for you folks to be members of and to bookmark. So the first one is super close to my heart, as well as many other ombudsmen across the country. It's the National Consumer Voice for Quality Long-Term Care. I was on the board of the Consumer Voice up until last year. My agency that I work at, Cori, and the Consumer Voice are very close, and as a lot of the other smaller agencies are members of the Consumer Voice. A lot of ombudsmen are utilizing the Consumer Voice website as the go-to for everything on the federal level. So if any of you need to access the CMS guidance on reopening facilities, you should go on to the consumervoice.org. They have a banner that runs to the left, and one of them is Learn About COVID, and you click on that, and then they have a whole page of everything you need and then some. The next one, which is a very good website for you to know about, is Justice in Aging. So they are a national agency as well. They're a legal advocacy organization. So they fight senior poverty through law. And they do not provide direct legal representation to individuals. So, but Justice in Aging, the reason why I put them up there is because if you're listening in on webinars, and chances are, if it's about nursing homes, chances are at some point you're going to see Eric Carlson's face. He is a legal attorney for Justice in Aging, and he knows the regulations inside and out. So that's a great place to go. There's also a booklet that they have available for download. It's called 25 Common Nursing Home Problems and How to Avoid Them, which is something that family members you should look at, you should see. So Justice in Aging, you can get that downloaded for free on that website. The Center for Medicare Advocacy, this was like, it's a little bit of a reach because they are Their mission is to advance access to comprehensive Medicare coverage and quality health care for older people and people with disabilities by providing exceptional legal analysis, education, and advocacy. So they're a little like high level in their thinking, but if you are ever needing some Medicare advocacy, this would be a great place for you to start. They have incredibly brilliant people on staff. Toby Edelman is one of them. She's been with them for a very long time, and she did a unbelievable presentation through the Consumer Voice where she linked there was a report that came out that linked infection control deficiencies in nursing homes to COVID positive cases in those facilities. And when you look at the data, it's just startling. And then, of course, the last thing that I had to put in here is the Administration for Community Living, which at the federal level represents the Long-Term Care Ombudsman Program. And I know that you all know the Ombudsman Program very well, but it's important to remember that, you know, the Pennsylvania State Long-Term Care Ombudsman is just, we're a cog in a much bigger wheel, because every state has an ombudsman program, and all the ombudsman programs sit under this Administration for Community Living. And it is definitely a good thing to know if you're ever talking to somebody who is having a problem with their loved one who's in a nursing home or assisted living in another state. You can click on, in fact, I don't know, Jamie, if you put it on here, the links. So the next page, I guess, right, has the links. Maybe not.
They're included on the email though.
Okay, so on the email, there are a couple of links about how to find your state long-term care ombudsman. So I know that, you know, it's hard right now because the ombudsman is in some degrees, you know, just as limited as families are, but it doesn't hurt to reach out to your local long-term care ombudsman. And I just want to make sure that everybody knows that that applies across the country. So what's happening next at Cori, we are madly scrambling to finish an issue brief, and we're going to start using that in our public policy advocacy. I am getting ready to just let loose on social media about visitation, and I'm also starting to collect best practices. So that is my next ask for you all. If anybody has any suggestions on what best practices you've seen, especially from people in other states, you know, recommendations on how, like, what we could actually say to decision makers about changing the guidelines in Pennsylvania so that we can try and get you folks in quicker to see your family members. So I'm Walsh at Cori.org. That's WALSH at CARIE.org. And I thank you very much for giving me the time again.
Lori.
Yeah.
Question for you from the chat. This is from Chris F. Have any of these organizations that you listed made any notable progress on visitation or an actual visitation plan?
So all of them have done pieces and parts of that. And I haven't had the ability to really dive deep and to see what's out there. I can tell you that the Consumer Voice, if you wanted to see, the Consumer Voice is sort of right now the place where a lot of best practices are being housed. So that's a good place to go. And, you know, because the way COVID has played out, it's so specific by state and then in some areas regionally that it's almost impossible to know for sure what state is doing what well.
Okay. I think we have a hand up.
Yes, we do. I see that it is S. McLaughlin.
Yeah, hi. So I wanted to, it's been a couple weeks since I've been able to jump on one of these, and I wanted to ask, what is the current guidance from the Pennsylvania Department of Health regarding when we will be allowed to visit our loved ones again? Is it still 28 days after green phase?
Yeah, nothing has changed.
Nothing.
Okay, so that's 28 days after green phase if there are no additional cases at the facility.
Yeah, they've got the step down. So step one, it's like whatever, 14 days, right? And then you move to step two, and that's another 14 days. And it still applies that if there are any new cases of COVID, that it would go back to, you know, the start,
Phase
which,
one.
you know, phase
That's
one.
at the facility though, not the county the facility is in, right?
Right, exactly.
Okay.
It's very
Yes.
specific toward the facility. And,
Okay.
you know, a bunch of stuff did cross my desk about how it does look like Pennsylvania is amping it up with testing. So it's entirely possible that we all might see an increase in numbers of positive COVID cases over the next like couple of weeks, because it really does look like they are, you know, helping to make that happen. There was an announcement about there's a partnership with a lab to make sure that they're doing the testing. I know that in Philadelphia, CVS they're sending teams out to do testing in our facilities. So there's a lot going on in making that happen. So we can definitely expect to see that I
Right.
think an increase for a
And
little bit.
Lori, I think there's some confusion. That's a big surprise. But I think there's some confusion about when the countdown actually begins toward reopening because of the
You and
testing.
me both.
They have to get that baseline testing done before they can start moving forward with a visitation plan. And the facilities are not all done their baseline testing.
And they have to also submit their implementation plan.
Right.
So that
It has to
first
be approved.
page of that document, there are all those bullet points about what they need to do. So, I mean, I do have to say that I think that Pennsylvania has not done a good job at making it clear what day one is.
Right, exactly.
And I just wanted to remind everybody too, in part of that guidance, each of the facilities are required to post what their visitation policy is on their the nursing facility website. Like on their website for the corporate or whatever, they have to have, you know, the plans posted for everyone to see what their visitation policies are going to entail. And they still have until, what is it, July 24th to get their baseline testing done. So we still have a good week and a half.
Now, Kim did a spot check on those plans just yesterday for her region, just randomly pulling up nursing homes to see if she could find their reopening plans. Kim, what did you find? Imagine, it's very interesting.
So I did 13 facilities across 3 counties, and all of the facilities I looked at had positive COVID cases at some point during the pandemic. Of course, the Department of Health site really doesn't indicate whether they're actively COVID or they had COVID 2 months ago. So it's kind of hard to tell exactly where we're at with each facility. The facilities are required to report their COVID numbers somewhere accessible to families, but that doesn't necessarily mean general public. So what I ran into when I did my research was that I couldn't find a reopening plan on any of the 12 facilities that I looked at yesterday. And it took me a considerable amount of time because I had to toggle back and forth between the Department of Health website and their spreadsheet listing, and then go in and try to find, by search, the facilities, their websites, and whether or not they had anything posted.
Yeah.
So I think that one of the things that really came to light to me yesterday, and I'm sure it will come to light to everyone in our group in the very near future, is that there really is no public place for this information to be stored in a way that makes sense. So if the Department of Health had a standard for collecting that information, which they do not at this point, it would be nice to be able to just click on any facility on the listing and see, are they in phase 1, 2, or 3 of the plan? But as of right now, that does not exist. So it's a little convoluted, and I didn't have a lot of luck. And again, I'm covering the North Central region, so that's an area that hasn't had near the impact of the Southeast or Northeast regions. And at this point in time, the southwestern part of the state, Allegheny and its suburbs and perimeter counties are being hit hard. So it's a crapshoot, to be honest, as to when we'll be able to actually get some concrete information on that. But we're trying really hard to try to track down where the pitfalls are for all of you. So it's what we're trying to do as best we can.
Now we will remind you, and Jamie will go over this in more detail in a few minutes, but we are expecting the Department of Health and the Department of Human Services to be on our call next Tuesday.
Whoa.
So these are the kinds of questions we need to drill down on. Holding facilities accountable for sharing the information. Where is it going to be posted? How will it be updated? How can families and the public access it? So please just keep in mind that important opportunity next Tuesday to talk to these guys about how this will all look moving forward.
Somebody in the chat asked us to go over the timeline again. I'm wondering if somebody could just get on the Google real quick and post the link right in the chat for folks, or send it in an email.
What link are you looking for, Lori?
It's the actual guidelines to reopen.
The reopening guidelines.
That's what somebody asked in the chat, if we could go over the timeline again, and rather than us trying to remember it.
Yes.
Because it's like,
I know what you want now. I know what you want.
Yeah. I also want to say, just to go back to what Kim had said, I'm not confident that the data that is currently on the Department of Health, the long-term care data about number of COVID in facilities is accurate. In fact, I know for a fact it isn't accurate, because I've been obsessively tracking my facilities, and every week since they started posting it. And from May 9th until June 15th, there were numbers that I could enter into my cute little Excel spreadsheet and take note of trends of the facilities. And then from June 15th on, most of my facilities, and if you look at the Excel spreadsheet across the board, it either has a 0 or it says no data. So I'm not sure at this point. In fact, if next week, if you're going to have the ear of the Department of Health, it's really important for you guys, the family members, you guys, to actually be the ones that speak up. So if you can make sure that you ask the Department of Health about that data, that would be great, because it's really, really important for us to know what's happening in facilities right now.
Absolutely. Do we have any more hands up, Carol?
No, I've been scrolling down back and forth. I wish some people would ask questions. I'm looking here. Or
Okay.
comments, not necessarily questions, comments.
Absolutely. And we'll make sure we post all of the links that Lori just spoke about on the Facebook page as well, so you guys can jump on over there. But thank you so much for the update, Lori. We always appreciate your insight.
Thank you.
You've done a lot of homework.
I'm sorry,
Oh.
and I just wanted, before I forget, there's one comment in the chat from Peg here. It says, side by side with the visitation crisis, is there any way to get information on the status of baseline testing in the facilities? And the answer is no,
No.
right?
The
I mean,
answer
that
is
goes back to
no.
what you were talking about, Kim, is that's what the
Yeah.
problem is.
Yes, you're correct, Lori. The answer is no. And the Department of Health is really relying on the facilities to provide them that information and self-report, obviously. So there is a lag. And I believe I also saw a message in the chat just now from someone who said that they've been waiting for the loved one's results for over 5 days. And I can only tell you that, yes, I believe that to be accurate as well. I understand that there has been some significant decrease in the rapid return of those results because the labs are quite heavily hit by the number of tests that are coming into them. So my understanding is there is some delay with the results. So that can be really challenging because by the time you get those results back, the status could have changed. So, we're relying on baseline results that may not even be time sensitive. So again, I think I don't blame the providers for that. It's just it's a systems problem, and it's occurring not just to nursing home residents, but it's occurring across the board, even to anyone who has COVID symptoms. So if you had COVID symptoms and you went for a test today, there's a good possibility that you won't get results for from that test for 5, 7, 10 days. If you don't get those results for 7 days, you're sitting in isolation waiting for the results when you could have been back to work in 2 days if they were negative. So it's a challenge across the board. But we know that is not just specific to Pennsylvania, that lag in testing result time is nationwide.
Yeah, Dr. Levine had a press conference yesterday. It was the first one in a while. And the question of the testing and the delay in the results came up, not specific to nursing homes and long-term care, but just in general. And she acknowledged that the system capacity has increased, but the demand in the Philadelphia and Allegheny area has really hit the system hard. And there are some significant delays in results because the labs can't process and in supplies for doing the testing. So I don't know how that will impact facilities and their baseline testing and the timetable, because if there is such a legitimate issue, will the Department of Health cut the facilities some slack? Probably. Do I know that for sure? No. There's an awful lot of fuzziness, gray areas, questions. We're struggling to get some bottom line definite answers from people on a lot of these issues.
Absolutely. And I did want to point something out in the chat. A lot of folks are talking about the essential family caregivers policy that Indiana and Minnesota enacted, which is a fabulous piece of policy. I did want everybody to know that was included in our notes to Senator Judy Ward. She did see all of the questions that you have asked, and I included that policy in the questions to Senator Ward. She said she is going to take that to Dr. Levine, so it will be reviewed. And they are in session this week, so fingers crossed. We'll see what happens, but I know we sent that up, and she agreed that it's a fabulous idea. So here's hoping we get some answers on that.
We do have a hand raised, Jeannie. I thought I saw her hand raised. Maybe she changed her mind.
Who was it, Carol?
Jeannie.
Jeannie Urban.
Well, it just says Jeannie. I'm not sure.
Oh,
Okay, I think I unmuted myself.
oh, there she. Okay, we found her.
Sorry. I'm kind of new to this. I had corresponded with my local ombudsman just the end of last week and had a chance to sort of dive into this. And I haven't had a chance to do a lot of reading, but I'm in a situation where I'm in a long-term care facility that has various areas. I live in independent living. My husband lives in skilled care. And before COVID, he was able to come to our apartment, move around the facility, that sort of thing. So am I understanding, with the little bit that I've been able to absorb and see here and read the last couple of days, that someone like him is probably going to be confined for a considerable amount of time? Is that kind of what things sound like? In just the way the reopenings are scheduled, it's a very step-by-step process, and it talks about visitation, but does it talk about residents being able to leave?
Unfortunately, no. Any of the guidance that came from Pennsylvania has been very restrictive.
Yeah.
And it also has not taken into account real life.
Mm-hmm.
So it leaves just a lot of questions up. And so, that's one of the things that I'm hoping, you guys, I really hope that after your meeting with Dr. Levine next week, that they really listen to you, because they should listen to you as family members, talking about these issues that you have, because it's unfair that a family member could be looking at that document and thinking that it's going to be until God knows when before you can actually see your loved one again.
Yeah.
And I saw the chat that came up, and I don't know. I don't understand. The last thing is, Lori, do you think that Governor Wolf really understands the depth of feeling and the outrage we feel about this isolation? I guess I can't really, I can't suppose, because I don't know him at all. But yeah, I agree that you think that you need to ask the governor to meet with family members. I think that this is one of those situations where the state response is just very prescriptive, and I think that it really is leaning towards the safety at the cost of all the things that we know about. So part of what our responsibility is as advocates and as family members is to just keep on reminding them that it's important for them to be thinking about the human element, and one of my pet peeves is the lack of person-centered approach. The fact that there's been residents have had absolutely no say in the matter, and they have a lot to bring to the table, and they should be allowed to make some decisions around assuming some risk, and they haven't been allowed to do that at all. So, I hope that after your meeting that you have with Dr. Levine, that she'll walk away having a better understanding of the human part of this.
We have another hand raised, Jim.
Lori, I want to clarify, Dr. Levine is not getting on our call next week, but the Department of Health and the Department of Human Services are both sending
Fine.
someone from their licensing bureaus and
Yeah.
policy.
I thought it was Dr. Levine. That would have been awesome.
No, it would have been tremendous, but I just want to make sure nobody's expecting Dr. Levine because
Sorry, everybody.
that is not happening.
Fine. It should.
Okay, go ahead, Jim.
Hey, hi, everyone. Again, thanks for all the work you guys are doing. It's fantastic. And to touch a little bit on Lori's approach of having the residents having some say in the risk factor that they're willing to take and can. And also along that line of how do we change the dialogue from what we can't do to what we can do? When I think about all of the facility workers, they get tested, they go home, they're exposed to who knows what, and then they go back to the facility the next day. And what if a family member is willing to go through the same testing that the workers will go through, even at our own cost? Maybe we could even go in and help, or what we could do. I'm just thinking of activities and stuff, not only for my mom individually, but if we're willing to help and stuff with it. But why do the workers go through one criteria or testing criteria and other people can't? Even as they say, we would be willing to pay for our testing if that would be possible. So I'm not completely understanding that. Has that been addressed?
It has not, Jim, but it has come up. I know when speaking to my residents and other family members, that is a big concern. And that's kind of what the essential family caregiver policy kind of entails. It would be assigning, a family provider, basically caregiver for each resident. They would go through all of the, testing, the PPE, all those safety steps, but still be able to provide actual care to the resident, their loved one.
We have another hand raised. It just says iPhone. Ever got an iPhone? Well, now I don't know. The hand went down. They're welcome to make a comment. Oh, there's two iPhones there, but now there's no hand.
No, maybe they changed their mind, Carolyn. That's okay.
Yes.
If we could, Carolyn, can
Also,
There is some
mark on the chat.
a purple iPhone icon. Whoever has that is welcome to speak.
Hello?
Go ahead.
Yep, go ahead. We can hear you.
Can you hear me?
Yep.
Okay, hi. I agree with Jim. My mother is at a facility where she has very much declined because of neglect. I had to get the ombudsman group involved because they had set up a tent right outside her window at the entryway, and they were spraying off employees. My mother was kept in a dark room. They said they couldn't open her blinds because of the tent, that it was a privacy issue. Finally, when her blinds were opened up, she is no longer able to speak. She just grunts. And this has really taken a toll. I have begged um, for outdoor visitations with her. She has been tested 5 times. She is negative all 5 times. Her roommate died. The facility had about 12 deaths. But you know, that I agree with Jim about why can't, you know, there was a high turnover. The employees, you know, they were hiring new employees all the time. You know, I work at a different facility. I am tested. I am negative, and all I want to do is be able to hold my mom and comfort her. This is extremely difficult, and I don't understand. It's taken a toll on the family's mental health, you know, as well as my mother. I'm finished.
Well, that I don't know what to say. I mean, it's breaking my heart. I don't think you're asking for anything unreasonable. I don't understand why that can't happen, and we're so frustrated because we want to make it happen, and
I know, and she's lost, you know, about 25 pounds, I think, as a result of just, you know, the employees were running scared. They were just dropping her food off and leaving, and she's had a stroke and she's unable to feed herself. I am actually considering bringing her home. It's going to be, but I am desperate. It's going to be a lot of work, but I just don't see an end to this.
Oh man.
Yeah, I mean, there's definitely a significant disconnect between the policymakers and in this, like, real life, what's actually happening. I do believe in power in numbers. You know, I do. I believe in power in numbers. So the more that you all can, you know, be vocal about your concerns and be willing to tell your stories, you know, it will tip it. I just hope that it happens fast, you know, because we don't have the luxury of time right now.
Lori, are you aware of any class action lawsuits?
So, you know, on the compassionate care, I don't know if anybody here is on that Facebook page and wants to, I'm looking to see if I recognize any names. But I believe that is somewhere in that Facebook stream, Morgan and Morgan, they were kind of fishing around for families. So I don't know exactly what they were looking for, you know.
Yeah.
It like, you know, usually in those class actions, it's very specific, right? So yeah, I don't know. I haven't seen anything in particular like pass in front of me lately.
Yeah, I wanted to say to the caller that, did you talk to the facility about a compassionate care case? They can be very successful. I'm not sure if that's something you were aware of.
Not, and I did not. And he says, you know, because my mother did not have, they allow recovered COVID, but obviously there's something that has fought this. You know, there's just so much that's unknown about this disease.
Yeah.
You know, I feel like if she didn't get it and her roommate died and she's around all these employees that are testing positive, and she's
I mean, I would, you
still
know,
has not.
unfortunately, your audio is
Yeah.
cutting in and out. But I would say, especially since you're in
Got
a
it.
situation where
I
your
think
loved one,
I feel
for folks on the call, it's important to remember that the compassionate care visit really hasn't been defined on the paperwork, which actually can work to your benefit, can also work against you. But it's something that could work to your benefit where you could just argue, you could just argue and argue and argue that, you know, if this, you know, whatever the circumstance is, that qualifies as a compassionate care visit. I would definitely, to the person who, I don't know if you're still on, but your loved one lost a significant amount of weight. And to me, that would be the thing that I would argue about, that it's imperative for you to get in there due to that weight loss.
Jim has his hand raised again.
Go ahead, Jim.
Yeah, several points. Again, mom is deteriorating as well. I go back to iPhone caller that mom is complaining that her legs are buckling now. She was a very active lady, and because of no exercise or getting out of her room, she's getting physical therapy. So the facility is responding positively. But again, we're all still coming from a negative standpoint. What can't we do? I know Judy Ward as a personal friend, and I was so looking forward to tonight to plead to her to get to that aspect of what positive steps can we take, not just for the visitation, but on the facilities. Mom needs to get out of her room. She needs to go to more activities. That means that the facility needs more staffing. Is that something the state can provide or can help with? Because obviously there's going to be a constraint on just how much they can do. Mom always says, I love playing bingo and I love being in the room with everyone, but we don't do that anymore. And it's a matter of always what they can't do or things. So with more people or more staffing, we can do this, and with more testing or things we can do. But I think we need to turn that edge of you can't do this, you can't do that, we can't do this, to, hey, with a little bit of help here, we could get them, the residents out of their rooms to walk the halls a little bit more. We could get the residents out to go walk in the garden a little bit more. Or if family members could get tested and come in and walk with their loved ones out to the deck where there's no one else exposed and things of this sort. I'm just afraid that we are so tied up in the negatives of it that no one is focusing on what positive things could be done. I guess that's.
I did ask a question of Senator Ward regarding any legislation for raising the staffing. And an answer that I received is that there is a representative attorney, or Anthony DeLucia, House Bill 1017, to increase the minimum staffing from 2.7 to 3.5. And I was so happy to hear that. But then when I looked it up, guess when the last action on this was?
Yeah.
April 2nd, 2019.
Exactly.
Nothing current.
Yeah.
Yeah.
So, you know, I do have to say that I do like the idea of spinning it to, you know, to really address sort of like what the benefit of relaxing the guidelines would do. You know, like one of the things that we were surprised about when Carrie We reached out to provider associations thinking for sure they'd be on board with this advocacy. And they're not because of fear. They're scared. But, you know, we were like, you know, we know that family members provide a ton of care for staff. So why wouldn't they be, you know, interested in it? But I mean, I do love that idea with kind of spinning in sort of like best practices or recommendations. That helps kind of change the theme of it to this is what we can do in order to, you know, to open up facilities. So
Lori, another aspect of that is looking at the negative aspects of continuing isolation. Isolation is not
yes,
the solution,
right.
but we're not focusing on what is happening. Mom is deteriorating mentally and physically
Yeah,
from the isolation.
yeah,
And it's like, oh no, but we're keeping her safe. Oh no, you're not. You're letting mom deteriorate. And if you did do some positive things, if we turn that, as you say, spin it to let's prevent the negative, the preventative measures are so much worse than what they're preventing.
so much worse.
And again, mom suffered through World War II, the Great Depression, and all the others, and now we're treating her like a kindergarten kid. Oh,
Yeah.
mom, you can't go out of the room. Get back in your room, mom. You
Right.
can't do this and you can't do that. Oh,
Yeah.
mom, you can't. Yeah, it's getting ridiculous.
Yeah,
And mom is suffering more from the preventative measures than she would if they had. If you'd say to mom, would you rather have COVID or would you rather be isolated? Guess what mom would say?
she would say, give me
COVID.
COVID, right? The last thing I'm going to say, because I know that the poll is up, which means that we need to wrap it up. I saw in the chat that somebody suggested that we get a template letter going, and I'm happy to talk to the folks here at Cori to see if we can create a template letter and share that with you all. Okay. So let me see what we can do on our end on at least crafting something that would be like global and maybe give you all an opportunity to talk about your specific issues.
Awesome. Thank you so much, Lori. Alrighty, and you guys seen the polls were posted. We want to talk about our upcoming meetings. Department of Health and Department of Human Services is next Tuesday. So please, please send us your questions for Department of Health and Department of Human Services so we can send them to them ahead of time. And then we're going to have our Secretary of Aging, and we're still working on one for August 4th. I'm working with Senator Judy Ward's manager to get her on the schedule for August. We just don't want it to happen again that she gets pulled into session. So we're trying to find a date that, you know, we can make sure that she's there. Next slide, please, Kim. This is the post that is on the Facebook page where you can submit your questions for Department of Health and Department of Human Services. So if you can hop on over, I tried to make it as bright as possible so it's very eye-catching. This is posted on the Facebook page and in the group chat area associated with the page. You can also throw your questions in the chat or, you know, email us as well. We want to make sure that we pass along all the questions for Department of Health and Department of Human Services for you guys. We don't want to miss anything. All righty. And as always, thank you so much for participating in our call. Head next slide there, Kim, so they can have our contact information. If anybody has any specific concerns, please send an email to the state office and we'll make sure we get the contact information for your local ombudsman to you. And there are the poll results for this evening. Okay, Lori, it looks like we're going to be doing a dedicated meeting for your Visitation Saves Lives and getting some folks to share their stories. So we'll
Great.
be putting that up on the calendar too for you guys and make sure we have access to it.
Great.
Please keep an eye on the Facebook page, and everyone take care, and we'll see you next Tuesday. But we'll also be in the chat and on the Facebook page as well.
Thank you.
Thank you.